And welcome to our live stream from Deuk Spine. I'm Dr. Deuk Majin, AP. Our patient travels from Pensacola, Florida with many years of back pain. How long?
Since 1995.
All right, we always say years, but, oh, look at that, beautiful. Since 1995, which is how many years? You can see the scoliosis on the x-ray. The bones are literally slipping around on the spine from the disc collapsing and the facet joints collapsing. 30 years of back pain. She had a spinal cord stimulator put in. Didn't do anything. We just took it out. You can see the incisions here and here. Waste of risk for the patient. Waste of money. But happens all the time. All right. Very good. Heading in. Shot. If you have questions, feel free to ask us. We'll do our very best to answer them for you. Now, we decided that we're going to put her to sleep because, well, she had a lot done. Surgically, we had to remove the stimulator and do a piriformis release. Hold on. I'm going to have to probably do a second incision, Luis. Okay. Let's... give me an AP. Let me have another needle. Right side is 3-4, right?
Yes, sir.
All right. And let's go back to a lateral. Shot. 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 I can feel that herniation. Okay. Let's go to the next level. Our first step in this surgery is going to be getting into those herniated discs. And somebody like her with this really twisted spine, it's not easy, it's hard, but we should be able to get it. We use the X-ray machine to help guide our approach. We call it the approach. Approach is in surgery shot, where you're heading towards trying to get to where you're fixing. And the actual, when it's open surgery, we call it an exposure, where you're exposing an area of the spine, for example, or brain. It's brain surgery. Shot. And so you have exposures and you have approaches. That's pretty good. All right, now we're going to do the L4-5 from the left. Everyone agree L4-5 left? I don't know that I can get in there from the same incision, Luis. I'll try. Let me see if the approach is any good. Shot. Actually, Luis, I think we can. Let's make the incision, and I'll use this left incision to do 2, 3, and 4, 5. All right. If you have questions, feel free to ask. I'm Dr. Deuk Majin, CEO and founder of the Deuk Spine Institute. I have my team here, including our anesthesiologist, Dr. Berndes. And once again, her pain comes from multiple locations, and we've identified those locations to be the piriformis muscle on the left, which we've treated, as well as these discs. Jordan, I'm not happy with that view. I think we're off on orbit a little bit, and we're off on WAG for sure. Oh, I need my headlight off, guys. The other problem she's having, that's nice, Jordan, that's really nice, thank you. The other problem she's having is facet pain, which we identified in clinic, and we're not actually treating today because we've got so much we're already doing. She's going to have to come back and get that fixed later. Shot? All right, and shot. Let's get an AP. Take my headlight up, please. Just unscrew the back. Yep, and watch the mic.
Yeah, we're taking the mic off because it's overhead. Okay. And then
That's not bad. It's not bad right there. Mm-hmm. Can you hear me okay, Henry?
Yep.
Any questions?
At this moment, no current questions.
Let's show the audience how do these disc injuries, such as degenerative disc disease, or watch the sterile field, how do they cause so much back pain? You could see from our video that it's a tear in the back of the disc that's the source of all that back pain that people have for years. As a matter of fact, the disc turns out to be the source of back pain 86% of patients with chronic back pain. And when we use the laser surgery here to repair those discs, the Deuk laser disc repair, we're able to get rid of 99.6% of the back pain on average. That's looking at 500 patients. We did a study. We're going to write it up and publish it. But that was just done a few months ago. Shot? 500 patients with chronic back pain. What? 500 patients with chronic back pain that 86% had disc pain from a damaged disc. And when we did the laser surgery, the pain went away. Shot? All right. We are entering the L4-5 tear, the annular tear and herniation. Shot? We are literally going in and straight through the herniation and the tear. You can see the dilator went into the tear. If you go back, you see the black line, that is the tear. And we are not damaging her disc by doing this. We're actually going in and we're going to clean the tear and remove all the pieces of herniation that are in there. All right. That will get rid of the pain. Let's show our audience how the laser gets rid of back pain by cleaning the tear.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK, 349-6922.
Okay, welcome back. You can see the laser. I'm going to show you. Somebody asked me the other day, what does the laser look like? This is the laser fiber. It's not the actual machine that makes the laser. It is called a fiber. And it's an optical fiber made out of glass. You guys see that? For reference, that is 1 millimeter wide, 1 millimeter. So think about the view we're getting here through this tiny little metal straw is about 5.5 millimeters. And the tear we're working on is about, 6 millimeters. We've spread it open a little bit with the tube by putting the dilator in, but this is all scar tissue from chronic inflammation. We are at the heart of her back pain. And I'm so happy for her. She's gone through so much. How many years do we say? 40 years? 30 years of back pain. And nobody's been able to fix her. And now we're going to get rid of her back pain. Now we still have her facets to treat in the future. We talked about that. We're just doing way too much today to add the facets. Otherwise we would have done the facets, but we had to remove her stimulator. And it's just too much to do for an outpatient surgery with no Foley and the type of anesthesia we do normally. Any questions from our audience?
At this moment, no current questions.
All right. It's Thursday. God damn that thing. May 16th. Is it 16th? Yeah. This is all that inflammatory tissue we were talking about. There's pieces of herniation. They have to be removed as well. If you don't get rid of the herniation stuck in the tear, you will never get rid of the back pain. It's actually these pieces of herniation you're seeing floating around that we're getting rid of, like that piece that just went by. It's those pieces of herniated nucleus that are causing the inflammation. They keep the tear open and they cause inflammation. There's another piece, just went out. So we release these fragments of herniation with the laser, and then we suck them out through the tube. That's the Deuk laser disc repair. This is the most advanced spine surgery in the world for back pain. It works. We've never had a failure. We've had a 1% reherniation rate, meaning that 1% of our patients will have another herniation right where I operated, and every single time that's happened, it's because they did something they weren't supposed to do. So what are you not supposed to do after surgery? Well, you have to give it 1 year to heal the disc. The skin will heal in a few days. The muscles will take a few weeks to heal, but I'm talking about the muscles in the back. But this disc, see? You see there's no blood supply here, folks? It's white. White means no blood vessels. And because there's no blood vessels, your body heals this very slowly. So notice how your skin is kind of pink. That's because there's lots of circulation there. There's lots of blood vessels. Your heart is red. That's because the heart has tons of blood vessels. The brain is kind of pinky red because the brain has a lot of blood vessels. It might interest you to know that the tissue of the human body that consumes the most oxygen and glucose per minute is the brain, per liter per minute. And that's because the brain requires glucose, which is a soluble sugar floating around in your bloodstream, for energy. And if your brain doesn't get that glucose, the neurons die, and you have what's called a stroke. Okay? Dead tissue. The most common cause of stroke is not enough circulation to the brain, or part of it. That comes from blocked arteries in your neck or in your brain. These are all pieces of herniation I'm pulling out with the grabber. And you can notice the surgery uses two tools to remove the herniation. One, the laser, two, the grabber. The grabber has a name. It's called the pituitary rongeur. Pretty standard instrument in spine surgery. And these pieces of herniation, there's about 30 per disc herniation. They are sitting inside this tear. And this is where all of her pain's coming from. I mean, her disc pain. Of course, she has pain from her facets, which we're not treating today, but the disc pain comes from the disc, and it comes specifically from a tear in the back of the disc. That was discovered by me and Arius Deuk years ago, my son. And we published the results of our surgery to fix those tears and get rid of back pain. Back in 2012, that was 12 years ago. That was our first paper. That was our first paper in the medical journals, but we did publish before that in 2009 at the national meetings. So really, we've been publishing this for 15 years, which brings me to my next point. Why are doctors not doing it? Because the answer is because there's no money for the big companies that sell spinal cord stimulators. They can't make money on this procedure. We're not putting anything in the body. You see? So they don't want this procedure known. They want you, the public, to not know about Deuk laser disc repair, which is why we have to tell you ourselves. You see, the way people find out about medical devices is through advertising. And the advertising is done by big companies that make money by selling something to be stuck in your body. So if we're not sticking anything in your body, there's no marketing. There's no advertising, and therefore there's no knowledge. The other problem is that surgeons today really are going for the big money, and the big money is not in laser surgery that I do. There's no money here, very little. Their big money is in putting metal implants like spinal cord stimulators, the one that she just had taken out, which don't work, by the way. Any questions?
Yes.
We are live streaming, right?
Yes, we have a couple of questions. This first one coming from Meta Ola on YouTube.
Hello, Ola, Meta, Ola.
Meta Ola, and they ask, do you fix lumbar disc tissues too? I hardly can walk. The doctor saying it causes from my spine lumbar. I had taken an MRI. It showed my lumbar has a nerve damage.
Yes, Ola. We fix lumbar discs. We're doing it right now. This is exactly the surgery you need. And if you want to know if you're a candidate, then you need to do a free MRI review. We don't charge you for it. Just go to mri.deukspine.com. Henry will post the link. Click on it, fill out our form, and you get to meet me. I will tell you what's wrong and what needs to be fixed and how to fix it. You can also ask me questions like about different types of treatment, different types of recoveries, and things like that. So we get about 8 minutes together. All right, there is the tear right there. And that's where all of this patient's pain is coming from when it's coming from the disc. So this disc we're talking about right now is the L4-5. Right, Luis? L4-5 is one of 3 discs that are causing her pain. We're fixing the first of 3. There's 2 more to fix. And remember, after we fix these discs, she's going to need her facet joints fixed, which she's going to come back because she lives in Pensacola, Florida. She's about 5 hours away. If I was driving, maybe 4.5. All right, now we did have a spinal cord stimulator we just took out of her. And we didn't put that up yet, right?
No, not yet.
Huh?
No, we did not.
Are you going to put that up on the YouTube channel?
Yes, very soon.
Yeah. So if you want to folks, if you want to watch a removal of a spinal cord stimulator, which by the way is a common problem, is people get these stimulators put in, they don't work, and then they want them out. You can watch it. We just did it. Also, we couldn't get the whole thing because what happens is the wires on the spinal cord get stuck in there, and you can't really get them out because otherwise you're going to paralyze the patient. So we did our best to remove it, but there's still some metal in there, not much, a little bit, and you're always going to have that scarred-in lead on your spinal cord, unfortunately. It's just part of life if you get a stimulator put in. So don't get a stimulator put in. Get your back fixed the right way, naturally, with the laser. Any other questions?
Yes, we have a question from Lanu on YouTube.
Oh, Lanu, welcome.
They asked about the annular tear. Can not standing up straight will weaken the annular tear?
Not standing up straight weaken. Yeah, I think hunched over is going to make it not heal. Well, they're not going to heal anyway, but you need to come and get it fixed. All right, there's the annular tear, and this blue stuff is herniation coming out. So the laser is going to remove those pieces. See that right there? That's herniation. It's stuck in the tear. You cannot heal this, Lanu. The only way to heal this tear is for me to come in and clean it first. And right now in 2024, I'm the only surgeon in the world doing this. Now, fast forward 25 years, 30 years, everybody's going to be doing the same surgery that I pioneered. Why? Because I've done every spine surgery in the world there is, and they don't work. This is the best. They don't work. Fusion will work, but it's highly invasive. So why have a fusion when you can fix it with a laser? So quite literally, you're watching history. Now, unfortunately, there are companies that don't want this procedure known because they're going to lose billions of dollars in profits every year when you're not getting metal put in your spine. So they're going to fight me. They're going to fight me. They're not going to want the message to get out to you. They don't want you all to know the truth. Watch the movie The Matrix. You'll understand how big corporation that is only interested in their own well-being and not yours, how they take advantage of human beings and use them. That's the Matrix, okay? In that movie, it's simple. We're being used for our energy that we produce. But in spine, you're being used as a recipient for a donation of a piece of metal and plastic that quite literally you don't need, but the company needs you to accept it. Otherwise, they don't get the big bucks from the government payers. So the government is funding this. Experiments on human beings, creating cyborgs, half human, half machine. Okay? Very bad. You don't want that. Wasn't there a whistleblower case recently, Henry?
I believe so.
There was a whistleblower case against Boeing, wasn't there? Anybody know about that? Can you Google that real quick?
Yeah. I'll do that right away.
That's right. Google Boeing whistleblowers. What do you see?
One moment.
So for those of you who don't know, Boeing, look it up, one of the biggest aerospace companies in the world, very powerful corporation. There were some whistleblowers, 2 men, who identified that Boeing was doing things they weren't supposed to do, illegal activities, right?
Yes, they raised concerns about it, and then just recently, like 2 whistleblowers suddenly passed away.
Suddenly passed away.
One guy was 45, and the other
45-year-old, perfectly healthy man,
yeah.
blew the whistle on corruption in our government and Boeing, and now he's dead. Sounds like something out of a book, but it's here happening in America today.
Joshua Dean, he was a former quality auditor at a key Boeing supplier. He
Yeah.
raised concerns about improperly drilled holes in the fuselage of a 737 MAX jets, and he has died from, suddenly.
Yeah. There were 2 of them. 2 whistleblowers, right? They came out at the same time, and they're both dead.
Yeah. There was Joshua Dean, and I'm trying to find the other name.
The point is, folks, big corporations want to protect their profits, and they're willing to kill people, even if people know they're killing people, in America, and our government does nothing to stop it. So it makes me wonder, is it really worth telling you all about the truth? How are we doing on irrigation?
Switch irrigation now.
My wife said, they're going to kill you. I said, I'm ready. It's my mission to expose the corruption because it's harming people. You know, it's one thing to have rivets drilled improperly on jets, right? A few people die, a few hundred people die. What's happening in the spine world and medicine from the insurance companies and these companies that putting all this metal in you is they're making billions of dollars. They're harming literally millions of people. So if Boeing was really ready to kill a few people, a few men, whistleblowers who are telling the truth to help people, a few hundred people, what do you think a corporation that stands to lose billions of dollars, tens of billions of dollars, hundreds of billions of dollars would do to somebody like me who's trying to make people aware of what they're doing to human beings? It's kind of scary, isn't it? So Luis, if I mysteriously die, anybody ever see this great movie? It's called King of Killers. Contract Killer. Contract Killer. You ever see that, Henry? Contract Killer?
I don't believe so. Sounds
That's
familiar.
one of the best movies I've ever seen. Anyway, you can't find it. It's really hard to find. They didn't have it on Apple. I looked on Amazon at one point. I didn't see it. Point is, this rich Japanese guy gets assassinated and puts up a fund, $100 million, to find his killer and bring them to justice. It's made back in the early 90s. This kind of thing has been going on for a long time, hasn't it, Henry?
Oh, yes, it has, most definitely.
All right, any questions from our audience?
No current questions, but we do have a comment from Meta Ola once more on YouTube.
Sure, yeah, Metal, why not?
Saying, oh my goodness, thank you so much. You're a godsend. I will cancel my spine doctor to do this surgery. I live in Fort Worth, Texas. It's been 8 months. I delayed the surgery because I'm afraid of metals in my back.
You don't need metal, Ola. They want to put metal in your back because that's where they make all their big money. But you don't need it. And it's going to hurt you. You got it? People that get metal in their back always come back for more treatment. I've never seen a single fusion patient, except for mine, that don't come back and get more treatment, more surgery, more shots, more pills, spinal cord stimulators, etc. So avoid the metal. You don't need it. We can fix you without it. All right, that should be it for this disc. That was 4-5. There's the nerve over there. You see how close the tear is to the nerve root. Nerve root looks good. What is this, Lisa? Uh-huh. All right, we're going to come out and move on to the next disc, which will be number 2-3. Scope off. Hey, Luis, you see this giant piece right here? Are you saving that for later? Thank you, Luis. Nice job. Okay, 1 down, 2 to go. Any other questions, Henry?
At this moment, no current questions. The medical lot did ask what the name of the movie was again. I just commented the name.
Contract Killer. Contract Killer.
Oh, it was this was beforehand. It was called The Matrix.
Oh, The Matrix.
Yeah.
Yeah. The Matrix. My generation, you say The Matrix, everybody knows what The Matrix movie is. The series, right? The new generation, you gotta wonder. Maybe they won't even find out about it. Pretty soon there will be the Matrix of life, the real Matrix, you know, happening. Okay, we are moving on to, let's see, X-ray, L2-3. And this is the worst disc, the most collapsed. I've got to get the needle out, but I put the guide wire through the needle. I've got to remove this needle, leaving the guide wire. And for those of you who have never seen these surgeries done, Sean, we do it the same way every single time. There's no need for variation. The only thing we vary is which disc and which side. Let's give a little num-num shot. So we're going to give a little bit of numbing medicine because I feel badly for Dr. Berndes today. He's a little under the weather. I want to make his job as pleasant as possible. He's not even looking at me anymore, Dr. Berndes. You're not checking me anymore to see if I'm putting num-num? I know. I'm just messing with you, man. All right, AP. All right, so our first surgery, this lady today, she's getting a bunch of stuff done, 3 discs fixed, and a piriformis and a spinal cord stimulator removal, which we already did, the stimulator removal. Now, after her, we're going to do another Deuk laser disc repair. The next patient will be cervical. Okay, 1 level cervical. So another general case, and should be quick. And then
He's a patient that a lot of
shot.
people ask about.
Really?
It's had lumbar, and now we're doing the neck.
Yeah.
People ask, can I do that?
Hold on, AP.
Of course you can, as long as you do the lumbar first.
Yeah. So Dr. Berndes is saying something important that, you know, I don't know if you guys are aware of this, but 2/3, 66% of patients with bad back disc problems, that's perfect. They also have cervical problem. Nope. They have problems with the weight with the cervical disc. It's all right. We should be good, yeah. And this patient next, that we're doing the cervical, he had already his back fixed. Now we're going to do his neck. And he was very happy with his back.
And many times the injury that triggers a bad back can trigger a bad neck at the same time.
Yeah.
Same incident.
Yeah, and I think just certain people are prone to disc injuries. If you go back to Tuesday, YouTube, watch the single level lumbar. It was the last surgery of the day, L5-S1. That was the patient who's having his neck done. So we're going to do his cervical next, and then we got 3 more lumbars. Is that correct? After the cervical? 3, we have a 5 level, and then we have a 4 level DLDR, and then a what? 3 level. All right, so we're doing a little countdown. 5, 4, 3. So we have a lot of surgery still today for you after this case, and plenty of opportunity to make some popcorn, get some milk duds, watch half of the Matrix, and then catch us at the end of the day. So this is the 2-3 disc from the left. I chose the left side because she had a pinched nerve on this side. I always go on the side that there's a pinched nerve, causing leg symptoms. And the reason for that is I want to unpinch the nerve at the same time as I get rid of their back pain. So I want to treat their leg symptoms and their back pain with one procedure. I could do, you know, what do you call it, unscrupulous things. I could just go on one side for the back and the other side for the leg and get more money from the patient, but I don't do that. That's not right. It's not ethical. There's the inflammation. Henry, look at that. Folks, it's perfect. Where's Sanjay?
He just left. He was gonna.
Sure he did. All right, get a picture of that. That is inflammatory tissue.
Copy that.
That is inflammation in the annular tear at L2-3. That is where all the pain comes from. Henry, I want that on our website, the new website. Okay?
Copy that.
Please let Sanjay know. That picture,
text-
get a few screenshots. Let me get in a little closer. Can you see the pink really well?
Yes, we can.
Oh my God. Every time I see it that bad, I just feel so good inside because I know this patient is going to do well. We're going to get rid of her pain. All right, see the laser? Say goodbye
Yes, we do.
to the bad stuff. That's what the laser does. Bye-bye pain. We're the only ones that do this. There's no other way to get rid of that without the laser. So when people talk about lasers are not necessary, blah, 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 they just don't use lasers. They don't know how to, and they don't have a laser. Because lasers are expensive. They don't want to spend the money. They rather buy a Porsche. Right? Anybody here have a Porsche? Anybody here want a Porsche? Huh? You? Berndes? You love them, all right. Well, we got to change that, Dr. Berndes. You need a Porsche. All right, let's say you could buy a supercar. What supercar are you buying? McLaren. Good choice. Why? Because they're so sexy? Jeez. I like a man who knows. Yeah, I like the fact that you can appreciate a good performance. He wants a McLaren. Luis, you're going to have a supercar one day. I know it. If you stick around with me.
Like Ferrari.
Ferrari. Wow, that's beautiful. What color?
Probably black. I like black.
Black?
I like black.
I love black Ferrari. That's my favorite. Yes,
Are we recording or are we online?
we're on live.
Can we take a break for a second? We just have a question for you.
Yeah. Go.
Okay, so the next patient, his wife is diabetic.
What?
The next patient, his wife is diabetic. We took a sugar on her, she's fine. But she's in the bathroom vomiting, she's
Oh.
hyperretic, she has also diarrhea. What my concern is,
You need to call the paramedics for her.
so we're gonna do vitals now, but my concern is,
No, we're not treating patient's wife.
You don't know if
We can't do that. She needs paramedics. So call the paramedics, have them come assess her. Okay? We're not in the business of treating vomiting and nausea and diarrhea, okay? All right, thank you.
my only concern is who's gonna drive them home now.
Doesn't matter.
Okay.
Yeah, I mean, he needs to get an Uber or something, but she needs to go get checked out right now. What's her sugar?
132.
It's not bad. She may have gastroparesis, you know, if she's been a diabetic for a while. All right, but she needs to get checked out. At least you need to offer it and document it. Yeah. Point is, she needs medical care, which we cannot provide. We're not that kind of doctors. We're not an urgent care center. Okay? I would tell her, you know, look, we can call the paramedics, which is what we recommend, let them come check you out. But she can't really drive herself to an urgent care, right? So, yeah. So I think she needs an ambulance. Okay? All right. So, unfortunately, one of our patients' spouse is having some, nausea, vomiting situation, and we're going to have to get some help. All right, but getting back to, what was I talking about? Oh, cars. Luis' dream car is a black Ferrari. That's good to know. I like that. Good taste. Who wants to go next? Nikki. Dream supercar. What? Okay, then we'll pass you. You're Italian, aren't you? Better be something Italian. Jordan, are you hiding from me? Don't tell me your dream supercar is a Siemens Arcadis Vanek flow machine. What is it?
That'll be an amazing supercar.
Right? Strap a motor on that baby. Drive around with a fluoroscope. All right, what's your dream supercar? Since we're on dream supercars. Any thoughts? You're going with the Ferrari. All right. Do you have a model? Ferrari. Do you have a color? Huh? Yeah, Ferraris are beautiful. What color though? Red, yellow, orange, black? White. I was gonna say, if it's black, you and Luis could like hang out together when he gets his Ferrari. Who's next on the supercar? Henry.
I was about to say, I'll go next.
Huh?
I'll say I go next. Mine would be the 2024 matte red Chevy Corvette.
Nice. There we go.
I'm not much of a car guy, but if I had to choose a supercar, that would be that
How
one.
many
for sure.
horsepower? Is that the 1,000 horsepower one?
I think so. It's roughly around that for sure.
All right. Who else wants to go?
Nissan GTR.
Nissan GTR.
That's a great one.
I don't think that counts as a supercar, but it is a good, very fast car. So I don't want to offend any of the Nissan, but maybe it is a supercar. But that's what you want, Nissan GTR. Who else? Where's Sanjay? Is he around?
No, I told him about the
By
photos.
the way, all these pieces of white stuff coming out are herniated discs. We've already seen from this disc alone probably like 30 that have slipped out, right? And you notice they're all different sizes. So it's important to understand a herniated disc is not one thing. It's not one piece of disc. It is a lot of pieces. And we are the first to describe that at Deuk Spine. Okay? We've done it in our videos for years. We've shown you guys these herniated discs. There are really many pieces. Second of all, they're pretty dried out and scarred up. The longer they're there and the more inflammation, the more scarred up they get. All right, so I guess I'll say my dream supercar is a, I'm never going to buy it, by the way. It's, I think, a waste of money, but Pagani, a Pagani. Pagani, like a Pagani Hyra, which is a convertible, because I love convertibles. I just think there's, you know, better places to spend money than a car like that. But I do love that car. I don't know, if somebody gave one to me, I'd keep it. But I can't justify spending $1 million plus on a car. Sorry. Sorry if I offend any car buffs out there. I'd rather spend it on patients, take care of them and get them better. Or a movie.
We have a couple questions.
Yeah, we'll take them.
This first one coming from Lana, once more on YouTube.
5 minutes on this disc, and then I go to the last one. Dr. B. Yes, Lanu.
Asking, for a healthy person, what are the best ways to prevent a herniated disc?
Yeah, the best way to prevent a herniated disc is, I hate to say it, but avoid trauma to your spine. So falls, car accidents. Just be smart about activities you're doing. If you have ever heard of this movie that's called, what's the one that Johnny Knox? Jackass. If you've never seen Jackass, watch Jackass. And avoid those types of behaviors. So, jumping off of roofs, you know, crashing in a shopping cart, you know, all kinds of stuff they do in the movie. Avoid those types of things. The problem is, to be honest with you, Lanu, that a lot of people hurt themselves when they're kids. Like they'll be on a skateboard, they'll fall, and they'll rip their disc. And then they won't have pain for 20 years. And then when they're adults, they start, you know, those herniations start getting more and more inflammation and pain. So that doesn't mean we don't see kids with bad discs. We do. The youngest person I've ever operated on with a bad disc was 15. Grab her. 14? 14, sorry. Oh, that was the guy from Seattle, right? The one that was going paralyzed? Oh my God, yeah, he was on the basketball court.
Really?
Oh, months ago, his mom sent me a video of him running on the basketball court. He was in a wheelchair before. Couldn't walk. That was the best. He was paralyzed in his legs. Yeah. Thank God we got to him before he was a complete spinal cord injury. All right, so there's a piece of herniation laterally. I'm going to have to use the laser to try to get it out. But I'm almost done with this disc. We did not use the blue dye here because I couldn't get it in. Any other questions?
Yes, this next question coming from Ann Justice for All on YouTube.
Oh, welcome to our stream. Good to have you back.
They said, "Good morning, dear Dr. Deuk.
Good morning.
My wife has weakness and pain on her left hand. She did a cervical MRI and it shows a small 0.05 centimeter tarlobe cyst on her C7 to T1 level. Could you treat cervical tarlobe cyst?"
Yeah, so first of all, my friend, that is not causing her symptoms, in my opinion. I have never seen a tarlobe cyst cause any symptoms in a patient. You need me to evaluate her. They're making the wrong diagnosis. I need to see her MRI. I don't know if I've seen it yet, but use the free MRI review and let me look at that MRI and let me examine your wife through Zoom. The other thing I would definitely want on her is a nerve test. I want a nerve test. I want to know where are these symptoms coming from. The nerve test will help figure that out. So a nerve test and the MRI and a Zoom meeting with me. And I will tell you what's causing her symptoms. But it is not the tarlobe cyst. Don't let anybody operate on that tarlobe cyst. It will not work. Now, am I 100% certain? No, but I'm about as certain as I could be. About 99.9%. Okay? Tarlobe cysts are common. They're totally asymptomatic. And real spine surgeons never operate on them. Ever. Ever. I've seen thousands of tarlobe cysts, and they don't cause any symptom at all. So I don't see why your wife would be the one who has it, symptoms. All right, so far everything is going amazing for this patient. We're almost done. I need another minute. There's a lot of really heavily scarred and calcified herniation right at the back of the disc in this one spot. And remember, this was the worst of the three, not pain-wise, the worst of the three structurally, like the most degenerated of the three. Okay? Any questions?
Yes, this next question coming from Meta Ola once more on YouTube,
Yes, Medola. Thank
asking,
you, Luis.
"What is my first step to do, doctor? I need that nerve test."
I didn't hear the question.
Meta Ola asked, "What is my first step to do, doctor? I need that nerve test."
Oh, did I say she needed a nerve test? I guess she does. Yeah, I thought that was the wife of the other guy. But if you have leg pain or weakness, numbness, tingling in your leg, Ola, you need a nerve test. And we do those here at Deuk Spine. I don't trust other people's nerve tests. They don't do them properly. Therefore, the information is unreliable. Unfortunately, nerve tests pay well, so doctors do them. Any doctor that can will do one, and they just don't know how to do it properly, so they do it for the money, not for the diagnosis. It's the truth. They should be limited to very competent doctors. Unfortunately, it's not. So we need to do the nerve test here at Deuk Spine, and that's when you get here. The next step is your MRI needs to be uploaded. You need to fill out the form. You need to do an MRI review. All right, I think we're done. I'm finding little pieces of herniation kind of off to the side. Jeez. All right, let's see here. There's the epidural space, a little bit of foraminal ligament. I'm going to take just a little bit more here, and then that's it. This is herniation that's come out of the back of the disc, and it's in the epidural space, behind the vertebral bodies. So it's amazing what you can see and do with this scope. You can get to herniations that other surgeons cannot get to. Normally, if I did this open with a laminectomy or microdiscectomy, I wouldn't be able to get this. You'd have to blindly scrape with a curette, a down-biting curette. 30 seconds. Jordan, are you ready? All right. Oh, one more thing I want to tell everybody. We never get 100% of the herniation out. The best we can do is about 70%, 80% if we're really lucky. But the average is around 50, 60. That's because of the way the body is shaped and the structures that are blocking you from getting everything. You cannot just remove structures to get to the herniation. Some structures are necessary to leave, so we have to work around them, right? All right, any other questions?
Yes, we have another question from Meta Ola once more on YouTube.
Scope off. All right, we'll take the question.
Saying, thank you so much. Is it safe to do chiropractor and decompression machine? And yes, I do have weakness and tingling, especially on my left leg.
Well, whichever leg you have weakness and tingling, you need a nerve test. So if you have it in both legs, you need both legs tested. We do that here at Deuk Spine. That's what I would recommend for you. As far as a chiropractor, I think it's okay. We like chiropractors. We used to refer our patients all the time. Luis, you want to do the staples on this side for the piriformis and the generator and the DLDR when you get a moment? All right. Keep the questions coming. They're great questions.
We have another question coming from Lanu, once more on YouTube,
Hello, Lanu.
asking, do cats and dogs suffer herniated discs?
Yes, they do. Cats and dogs do suffer herniated discs. I've never done surgery shot on a cat or a dog, but I could, I guess. I think there are veterinary neurosurgeons out there. I may have to call one someday. I will tell you a funny story though. My dog got attacked by another dog, and she had a laceration on her scalp, or on her, on her thorax. We took her to the emergency room for dogs, and we had a bill for $10,000 by the time we were done. You know, they did surgery and all these tests, $10,000. It kind of scarred me, to be honest. I mean, I love my dog. She survived, and she shot, and she did well. You know, she made it. But to be honest, her wounds were like not life-threatening, though they kind of made it sound like it were. That said, my next dog, and I had 6, she she got into a fight with another dog. She's a German Shepherd, Anya. Let's get an AP just to look. And she had her scalp was half sliced off, but you could see her skull, and the skull was fine. Okay, and her ear was kind of hanging off. And my wife said, "Oh, let's go to the urgent care center," and that memory of $10,000 like hit me, and my chest tightened up. I'm like, remember this? Louise remembers. I'm like, how about you let me try to fix it first? She's like, you're not a veterinarian? I'm like, wait. I'm like, yeah, I know, but I'm a neurosurgeon, for God's sakes. How hard could it be? I think I can do this, right? We did a lot of scalp lacerations when I was a neurosurgeon. So I'm like, I got this, you know? I stayed at the Holiday Inn Express. So I called Louise up, and I said, I need some help. I need saline, I need stapler, I need irrigation and betadine and blah, blah, blah. I mean, we must have spent like $100, under $100. That's it. And were you there when I stapled her up on the car? Oh, shot? Yeah. Anyway, I came here to our surgery center and took care of her. And she did fine. She looked great. Her ears were symmetric. You know, I think that's it. She was perfect. She made a full recovery, no infection. Cosmetically, she looked good. Her husband did not divorce her, Max. I'm kidding. And I saved $9,900. So I just thought that was an interesting story. Then I got to tell you another dog story, since somebody talked about dogs. My son's favorite dog is Sebastian. He's a little wiener dog, Doshkin. And if he gets too much fat in his diet, if he gets a piece of fat, which we didn't know this at the time, but he gets pancreatitis. So his pancreas acts up and he gets vomiting and feels miserable. Like gets dehydrated, right? He can die. So we did that once. We didn't know. And we took him to the vet. They said, oh, yeah, he's got pancreatitis, right? We spent a couple of $1,000, IVs, you know, overnight, the bills. So once again, this is after my veterinary success with Anya. I said, you know, let me get some normal saline. Let me get some normal saline and a big syringe.
Okay, thank you.
And what I did was I just injected him sub-Q with saline, you know, sterilely. Like 4 times a day. I'd give him about 200 cc's under the skin. And he did fine. And he survived. So again, saved some money there and had an experience. And I think Sebastian actually respects me a little more for that, you know, because I saved his life. I don't know, just a thought. Any other questions?
Yes, we have a couple questions from Laura on YouTube.
Hi, Laura, on YouTube.
They asked, just a question, what happens when all the disc material is degenerated and none remains between 2 vertebrae? What kind of treatments do you do when that happens?
Yeah, Laura, that happens a lot where there's no disc material left. As a matter of fact, we just fixed one. The one we just did was that. We do nothing with the disc. You don't need a disc. Your body does not need a disc to have a normal, pain-free life. And that's been proven over and over again with fusions where they take the disc away, or artificial discs where they take the disc away. So you don't need a disc. And even in that situation, Laura, the cause of back pain is still the disc. And this procedure you're watching right now is the cure to that pain. You don't need a fusion. You don't need artificial disc. Dr. Berndes, we have 10 minutes maximum. So I guess what I'm saying is we don't do anything. And you don't need anything done. Now, surgeons and pain management doctors and therapists, they're all going to try to sell you on doing something, you know. But you don't need it. You just need the annular debridement, which is what I'm doing right now. You need this laser debridement done. And like I said, this is what every spine surgeon around the world will be doing 50 years from now. You know, 30 years from now, maybe the United States and a few other countries, but 50 years from now, every single spine surgeon in the world will be doing the Deuk laser disc repair for their patients with back pain. Okay? And if they have facet pain, they'll do the Deuk plasma rhizotomy. Both procedures that I pioneered here. And if they have piriformis pain, which happens time to time, less than 5, let's see, piriformis is probably, it's probably in 20% of the patients. They'll be doing our piriformis release. We've literally pioneered the most advanced treatments in the world for 99% of back pain. That's because we know where it comes from and we know how to fix it. But you don't need anything else done. You don't need anything stuck in that disc. You don't need fusion. You don't need anything. You don't need a stimulator. Now, the thing about our procedures and why they're not wildly popular is because they're cheap compared to the stimulators, the fusions. There's no money from implants. We're not putting an implant in. There's no implants. The entire spine industry is based on implants, putting metal, plastic in patients to not fix them, but, you know, basically to make money. And the patients go on to have more procedures done and need more treatment done, and they're never out of pain. Our procedures cure pain. And we're the only ones that do it. And we do it naturally by targeting the source of pain and not putting any implants in. Now, could I do an implant? Sure. But is it necessary? No. I thought about it, and the only implant I ever thought about putting in, I am patenting, but it would only be to speed up healing of the disc. We talk about how the disc takes such a long time to heal. Well, people don't want to wait a year. So I was developing something that would speed up the disc healing. Look at the inflammation there. You guys see that? The pink?
Yes, we do.
That's another area of inflammatory tissue. So the person whoever said, I think, oh, if you have no disc left, what do? Well, that is what needs to go right there. You get rid of this, and the patient's pain is gone. 5 minutes or less. I'm letting my anesthesiologist know we're just about done so that he can dial back the anesthetic and get the patient ready to, what do you guys call it? When they wake up? Berndes? Huh? No, what do you guys call it when the patient wakes up? Emergence? Yeah, emerge. For her to emerge. Emerge. Sounds like a moth coming out of a cocoon or a butterfly or something, right? Emergence. But it's pretty cool. I like emergences. How about you, Luis? Are you an emergence kind of guy?
Yeah.
You'd like to emerge with a black Ferrari under your bottom, wouldn't you? You know what, Luis? I'm going to make that happen for you. I promise. I promise. You all heard it. Luis is like, Henry, give me that tape. Give me that tape. I need it sent to my email immediately. Luis has been very loyal and dedicated to our company. And he's a very understanding person, even when I'm tough with him or anyone else. All right, this is it, the end of the disc. You guys see that? I'm just cleaning up the last bit. You guys saw the inflammatory tissue?
Yes, we
Is
did.
that me or somebody else making her move? It's probably me, right, Luis? Were you pushing on her? Oh, you're putting some down pressure? All right, that's fine. No, it's fine. I just didn't know if that was her moving or if that was you. All right, any other questions?
Yes.
All right, before you ask, folks, type up your questions. I'm going to do something I haven't done in a while. I'm going to come and answer them for you face to face. So we can have a nice little session. Henry, the only thing I ask of you is see if you can get me some fresh coffee.
Copy that. I'll contact Cassie.
Have Cassie bring me some fresh coffee. Type up your questions. I'll be there in just a moment, but we are done with this lady's surgery. She had a lot done. We're done. And I am excited to get her out of pain. All right.
Saving off, please. Thank you.
Scope use is a 7. See, that's the way to do it. Thank you, everybody. Great job. You got the Piri? Yeah? What is... Oh, that's me.
Yeah, that's
All right. All right, let's go to our testimonial, and we are pretty much done here. You
Copy
wanna
that.
do that one?
I'm here with a gentleman who came to the Deuk Spine Institute with horrible back pain, pinched nerves, symptoms down your leg, weakness, numbness, and using a walker. He's been struggling now for quite a while. You had the Deuk laser disc repair done yesterday in the morning. We went in with the laser and we cleaned out 2 discs that were really causing pain in your back. They were herniated and starting to degenerate. How do you feel today?
10,000 to 50,000% better. Absolutely wonderful. I can't even, it's hard to explain. Going from not being able to walk 5 feet to being able to almost just walk around the block. It's one day. I mean, it's 24 hours. It's incredible.
And when did you realize you had this relief on your back?
Yesterday, when I got home and got settled down, and there was no pain. There was no pain in the back. There was no pain all the way down the leg to the big toe. It was like, where'd the pain go? It just dissipated. And that's after surgery. So usually you feel like there's surgery, there's gonna be some pain. No pain. I can't even explain it.
Well, you're doing a good job. What was life like before you had the Deuk laser disc repair surgery?
I didn't want to live this way. There was no way I would never want to live that way. Never want to, no. Excruciating pain. I mean, can't sleep, awake all night. The pain was constant, it never left, but you got so exhausted from feeling the pain that you would finally fall asleep. I would finally fall asleep anywhere from an hour to 2 hours at the max, and 2 hours was a gift, and that's all night long. I had to sleep in the room by myself because I would have kept my wife awake all night. I was just miserable, the most misery I've ever felt.
I met your wife. She's a lovely lady. She's by your side all the time.
Yes, sir.
It's hard when you have so much pain. It takes a toll on you, but also your loved ones.
Yes, it does, and she's been a God's gift. I will say that.
How does she feel about your surgery you had yesterday?
She's very happy for me. She's been through every day of it, and this started before Thanksgiving, and we are 3 days from Christmas, and I'm gonna have Christmas without pain. Thank you, God. Thank you, doctor. Thank you,
welcome.
everybody in the staff. This staff is unbelievable. Nicest people I've ever met.
Well, we care about people like you. We want you out of pain and happy and getting on with your life. And tell me about your job. You have an interesting job.
I do. I love my job, and I call it the greatest part-time job in the world. One of the highlights of my job is something I can say about it is it's a job where you can say no to work and you'll have a job the next day. It's the only job in the world that I know you can do this. I'm a stagehand with the International Alliance of Theatrical Stage Employees out of New York, and I love my job. I do everything from entertainment, theaters, arenas, to trade shows.
What's the best show you did?
I've worked with 2 out of 4 Beatles. I've worked with, everybody from Kenny Rogers to Celine Dion. I've worked with Van Halen. I've worked with all big entertainment. And then I've done a lot of medical trade shows, so I know where I'm at. When I come into a medical facility, I look around and go, oh, I know where that comes from, and I know where that comes from. And it's a great job. It's a wonderful, wonderful job. I see things before normal people see things. I saw the first flat screen computer and I didn't think too much of it because I wasn't a computer person. Now it's like, look at the flat screen TVs, and it's a great job. That's the trade show side, the side where what keeps our country moving is people buying and selling the products that we use, from the cameras that are on us right now and the lights that are on us right now to doctor's coat that he's wearing and the shirt that I'm wearing. So
and probably
it's
some of the
incredible.
equipment we used in your laser spine surgery.
Absolutely. The best shows I do, I have to say, are the medical shows, because I go around and I get literature and I read and I learn from past experiences with herniations. I've had double hernia surgery, so I know about that. I've had hand surgery, I've had knee surgery, now I've had back surgery. So I learn, and it's, you get to talk to the people that do the work and represent the products, and it's pretty awesome. So I love my job. I miss it. I honestly miss it.
Well, now you're going to be able to go back to work without that pain.
Oh, thank God. Thank you. Thank you, Doc.
You're welcome. Is there anything else you want to say to your fans out there?
If you're having issues, any kind of issues with back, knees, joints, you need to come to Deuk Spine. You just have to. The Institute is wonderful. Everybody here, there is no negativity in this building whatsoever. It's unheard of out there. And I've seen a lot of doctors over the years for different reasons, but there's no negativity here. It's all positive, and you leave positive. So I'm very, very happy that I did this. And I tell anybody that has ever gone through any kind of pain, you need to come see Deuk Spine. People come from all over the world, and now I know why. I just came from up the street, so I can tell you, up the street or from another side of the country, just come to Deuk Spine. That's the best I can tell you.
Well, thank you for sharing your story. Congratulations and Happy New Year.
Happy New Year and Merry Christmas to the whole staff. All your people are excellent, to your family as well, and their families. And I hope everybody has a wonderful Christmas. And by the way, the office is magnificent. That is the best I've ever seen. That shows when you walk through this office for Christmas holiday, it's all about family. It's all about the holidays. It's about the people that come through.
Thank you.
Thank you
very much. What a great testimonial that was from one of our patients. So we've just finished a very complex spine surgery on this lady from Pensacola, Florida. Tuesday, 2 days ago, we had a patient from Nebraska, Guam, the island of Guam, New York, and Atlanta. Nobody from Florida, even though we're in Florida. Today we have all over the country again. And we'll list it. But this patient we've just completed is a Floridian. She's up in Seminole County with those knolls. So, it may be another country, right? I'm a Gator from Gainesville, and there's a long history of rivalry between the Gators and the Knolls. So I'm just glad my daughter didn't end up up there.
FSU.
Yeah, in Tallahassee. So this patient had her spinal cord stimulator taken out, which we didn't show you as part of this stream. It was done earlier. We recorded it. We'll post it on YouTube. Dr. Patel did most of it. But it brings up an important point worth discussing. Why are spinal cord stimulators implantations on the rise? The answer is simple. I'm going to show you. Oh, somebody took the glasses. They must have been Patel's, right? The answer is simple. It's money. These are very lucrative, look up that word in the dictionary, procedures, spinal cord stimulators. And they're being done all over the country. They're being pushed by the pain management doctors, who are being pushed by their investors, which is basically Wall Street has been buying up pain management clinics, pushing the doctors to do stimulators on patients, which they push their patients. So what's the problem? Patients trust their doctors, number one. Number two, patients are in pain. And when their surgeon is telling them, you need a stimulator, they're going to listen because they're desperate.
We are taking advantage of these people, and it disgusts me to no end. It makes me angry to see it happen. These stimulators used to be only recommended in people with permanent nerve damage that could never be fixed. And we would put in the United States, probably somewhere around 50,000. This was 20 years ago, a year, 50,000 a year. That's all that we needed. Now we're putting in over 1 million of these stimulators a year. Crazy, the rise of spinal cord stimulators. And what's driving it? The answer is simple: profits, profits, profits. The companies that make them are making obscene profits. The doctors that put them in are making obscene profits. The surgery centers and hospitals putting them in are making obscene profits. The only person that's suffering is the patients, and you need to be aware of that. So I'm telling you all, you won't hear this from any other surgeon because they don't want you to know the truth. They want you to keep being a recipient for their deposit. They want to deposit a stimulator in your back so they can deposit more money in their bank account. And it's infuriating to me because I was brought up, my father was a doctor, he told me always do what's best for the patient. And so I thought every doctor was that way, and I found out that's not the case. Here's the problem. I know it's not the case, but I'm not a patient right now, right? I'm a doctor. So I need people to know the truth because it's your body that's being harmed with these treatments, whether they're screws and rods, whether they're stimulators. If there is a better way to fix the problem, you should get it done with the better way. Stimulators are never the better way, ever, ever, ever. There's a very small group of people, tiny, tiny fraction of what's going on right now, that people that need a stimulator, maybe 0.1% of what we're seeing today getting stimulators. This patient had a stimulator. She came here and said, "Oh, you're going to fix my disc? By the way, will you take my stimulator out?" I said, sure. And we added it on, okay? But of course I asked certain questions like, is it working? You know, she said no. I said, does it help you at all? She said no. I said, is it on? She said no. I said, if you turn it on, turn it off, turn it on, turn it off, is there a difference? She said no, nothing. I said, okay. In that case, you really want it out? We'll get it out. So we took it out. We have a video on that earlier, which it wasn't streamed, but we'll put on YouTube. All right, that said, we then did the piriformis release as well, and we just finished the 3 discs. I think she's going to get 90% of her back and leg pain gone permanently with our laser surgery and the piriformis release. She never needed the stimulator. The only person that needed the stimulator was the surgeon and the company that makes them. They needed it put in her. All right, who's next?
This question coming from Lanu, once more on YouTube,
Hi, Lona.
asking, are any pet insurance aware of Deuk laser disc repair? You might get some requests from pet owners for their dogs.
Lanu, I like the way you think. I really do. I love my pets too, and if they needed surgery on their spine, yeah, you're right. The Deuk laser disc repair would be the best way to do it. Lanu, if you want to start that line of business, I will take care of the pets. I will do the surgery. Obviously, I can't fly anywhere. They have to come here. But if you want to come to Deuk Spine and start our veterinary arm, heck, why not? You know, I love animals, and if they're in pain, I'd love to get them out of pain. It's intriguing. You're bringing up something that nobody else has ever talked about or really thought about. But you're right. I mean, caring for your animal these days is so expensive, especially, same thing. I mean, these people take advantage of pet owners. So, all right, next question.
Next question coming from Deborah on Facebook,
Hi, Deb.
asking, what if someone has osteoporosis? Will your surgery work? All the neurosurgeons I have consulted with refuse to touch me.
Yes, Deborah, 100% osteoporosis. We can fix your spine, no problem. The reason these surgeons don't want to touch you is they know you're going to need metal, screws and rods, and that once they put that metal in you, that you're going to fracture your bones around the metal. You're going to need more surgery, and they don't want to be responsible for that. So the laser surgery that we do is the perfect treatment for people with osteoporosis because we're not putting any metal in your spine. We're not messing with your bones. We're only fixing the joints.
And that is it for questions.
All right, thanks for joining us. We'll see you in about 30 minutes for a cervical, one-level Deuk laser disc repair. This patient is from New York, and we're going to go in and use the laser to zap away his herniation. He had his back fixed the other day. He said he's doing fantastic. He has no back pain, and he had a pinched nerve going down his leg. He says the feeling is already coming back in his leg. So that was just 2 days ago. All right, thanks for joining us. Dr. Deuk Majan here with Henry, and we are going to grab some lunch from Moe's, and then we'll be